going to talk about the food recommended for the lung disease patients. Especially when it comes to the food, most of the times patients when they visit the doctor, they will ask a lot of questions about the food. So I'm going to talk briefly about the food which is recommended for the COPD and asthma patients, and especially for the patients other patients who are having other lung diseases. The first thing is for the asthma patients, one thing that they should know is like the foods which are really precipitating their asthma symptoms, the triggers. They should avoid what are the foods that is precipitating their or increasing their cough or breathing difficulty. Those foods they have to stop. Especially when you look at the asthma patients, some people may be having an allergy to the seafoods and some may be having an allergy to the peanuts. So those foods actually they really need to avoid to prevent the worsening of the disease or to have an exacerbation. So the food which I recommend for the asthma patients is an foods which are rich in on antioxidant. For example, like the fruits, and if you take the broccoli, these foods are really having a high content of an antioxidant rich content food. So it's better to take them regularly in the meal. And the other one is a other antioxidant property which we see which is recommended for the asthma patients is a omega-3 fatty acids which are high in the fish. So when most of the times the patients will ask, can we take a non-veg? Yeah, but I strongly recommend it to take the non-veg for the patients who are having a lung disease, because the high protein content is recommended for these patients, because especially when you take the COPD patients, they may be having an increased inflammatory response which in turn leads to the weight loss. For these patients, they should have an adequate weight which will further keep them in a good health. And if the patient is very emaciated, there the lung functions will worsen and the symptoms also worsen. So to maintain adequate recommended height is very much recommended for these patients. So I recommend them to have a high protein diet. And most of the times the COPD patients, when they take the feeds, especially when they take 3 times a day a meal, I suggest them not to take the meal at a time and divide it into small portions and take it at regular interval. So better to have the small amount of the feeds at a frequent intervals, which is recommended, because if they take large meals, that will worsen their breathing difficulty. So next comes is the carbohydrate. So actually the carbohydrate, most of our, like being in South Indians, most of the times we prefer to take rice 3 times a day. But instead of the rice, so instead of the rice, it's better to take the whole wheat and brown rice if at all it is available. Instead of taking an 3 times a rice meal. So the other thing is, especially for the COPD patients, it's better not to take the high carbohydrate diet, because high carbohydrate diet actually increases the CO2 retention. So these are the simple tips. And apart from the medical management, having an adequate and balanced diet is very important to control the symptoms. Thank you.